Good afternoon, everyone. We want to thank you all for connecting with us for this Health Emphasis Weekend, which is a collaborative effort of the South Andros and Mangrove Key District of Churches with the Health Ministries Department of the South Bahamas Conference of Seventh-day Adventists. We thank you for connecting with us via Zoom and YouTube this afternoon. We are going to have a segment which is entitled Ask the Doctors. Our moderator for this setting or this segment, this panel presentation, is going to be our Health Ministries Director, Sister Nathlyn Lacroix. Before she comes, I will begin with the word of prayer. Our Father and our God, we thank you for the opportunity to connect in this fashion with brothers and sisters across the South Bahamas Conference and even the world. We thank you for this initiative, which you've placed in the heart of our health director. We pray now that as we discuss in dialogue, that knowledge will be imparted and we will be better equipped to take charge of our health. In Jesus' name I pray, amen. Sister Lacroix.
Good evening, everyone. Thank you so much, Pastor Black. Good evening, or good afternoon, rather. Good afternoon. I'd like to welcome all of you to this Ask the Doctor segment. Ask the Doctor. And we have 5 highly qualified persons who have consented to be a part of this discussion this afternoon. Just before we go into the discussion, I would invite each of them to introduce themselves, tell us the area of specialty, and then we will continue with the program. But just before they introduce themselves, let me just set some ground rules. It is a question answer program. However, we will be entertaining questions that comes through the chat. Okay, so you will keep your mics muted. Any questions that you would have, you just type them into the chat. We would read it and direct it to the person or the doctor to answer, okay, or the person of specialty in that area. Thank you so much. And so at this time, we will start. Once I call the doctor's name or the individual, you'll just introduce yourself. Dr. Joseph Evans.
Good afternoon, everybody, and it's a pleasure to be with you this evening. My name is Joseph Evans. I'm a urologist, having practiced urology for some 41 years. That's the area of my specialty. And I'll be happy to answer any question you have in that field or any related area. And I'm looking forward to this evening's program.
Okay, thank you so much, Dr. Evans. Dr. Elvira Higgs. Okay. I thought I saw on Dr. Monique Mitchell.
Good afternoon, everyone. Yes, my name is Dr. Monique Mitchell. I guess I have a lot of experience in health, but currently I'm working as a podiatrist. That's a foot doctor, a specialist that deals with the lower extremity. So it has to do with any health complaint or any concerns persons may have with the feet and the lower extremity. It actually starts from below the knee down, so we can treat any condition that deals with that area. But I fancy myself a health practitioner, I guess, because I'm also a registered nurse, a health educator, and I was also recently qualified as a lifestyle medicine practitioner. So I just love health. Thank you.
Thank you so much, Dr. Mitchell. Dr. Alpheus Alec.
Hi, good afternoon, everybody. I am an emergency physician by specialty. I've been practicing medicine for about 16 years. Well, yeah, this year is going to be 17. So we're at the forefront of everything. So we deal with acute medicine. So and I've had experience in ambulance services, air ambulance and air transport, and then the emergency rooms of both public and private hospitals. So currently at Doctors Hospital at the ER. Aside from that, my interest in health pushed me to CHIP certification and health education and all the rest of it, and just being part of encouraging a healthy lifestyle. So it's a pleasure to be here, and thank you for the invitation.
Okay, thank you so much, Dr. Alec. Dr. Vanessa Miller.
Hi, it's a pleasure to be here joining you in South Andros and wherever you're joining from. Actually, I believe there may be others. I'm an obstetrician gynecologist and for 21 years. And my area of interest, though, is in health promotion and lifestyle changes to prevent and reverse chronic diseases. So I am hoping that in the near future, I will be able to focus more on that area of preventive medicine, lifestyle medicine, and preventive health.
That sounds wonderful. Thank you so much. Thank you so much. Ms. Shandira Smith.
Good afternoon. Happy Sabbath, everyone. So yes, as Sister Nat said, my name is Shandira Smith, and my area of specialty is nutrition and dietetics. And I really love it because I love food too. So they go together very nicely. And I've been practicing but this is year 16 now, and I am absolutely loving it. I think this is what God has taught me to do. So I'm going to do it, continue to do it with all that I have.
Okay, thank you so much. Dr. Elvira Hay. I saw Dr. Higgs. I think I saw her earlier. Okay, so we will go ahead. Persons who may have just joined, if you have any questions for any one of our facilitators this afternoon, feel free to put it in the chat and we will read your question and direct it to the person to answer, okay? And so at this time, we'll start with the first question I'm seeing here in the chat. I think this is, how do you get heel spurs? I think that's a question for Dr. Mitchell. How do you get heel spurs?
Good afternoon. Yes. Sorry, couldn't unmute. Heel spurs are, well, that's very fitting because heel pain and heel spurs is one of the most common conditions that I see in my practice, and is one of the most common things that persons experience, I guess, in terms of the foot. So before we get into how we treat the heel spur, let's talk about what it is. A heel spur is an elongation of the heel bone that's on the bottom of the foot, and it usually presents with pain, swelling, especially pain first thing in the morning. That first step in the morning is painful, and persons tend to have pain if they're sitting for a while and then they get up. That can also be painful. So that's usually an indication of plantar fasciitis. And when we do an x-ray, then we will actually see the spur on the x-ray. So to treat that, well, to prevent it, it's most often commonly seen with persons with flat foot, persons who tend to walk barefoot or wear flat shoes, who may have gained some weight over recently. Those are common things that happen why persons will tend to get this problem. And so to treat it, we would actually encourage persons to stop doing any of those things that they are actually that's contributing to the problem. But there's many treatment options out there, including just as simple as stop being barefoot or flat-footed, as well as stretching exercises can help because the plantar fascia needs to be stretched out. You can also, we can also treat it with NSAIDs, or you can use natural NSAIDs such as ginger, turmeric. Those things would help. And then we can also do injection, changing the shoes. So there's a lot of treatment that can go on for heel spur. spur and plantar fasciitis. I hope that answers the question.
You muted, Sister Nathan.
Okay, let me leave that open. Okay, sorry about that. Good afternoon. This is a question coming from the chat. Good afternoon. I was diagnosed with hypertension about 7 years ago. I am taking medication, but would like to know how to get off meds, practicing a healthy lifestyle. So that is a pretty open question to all our panelists. How do I get off this medication that I'm on for hypertension? Should I call a name?
Okay, let's try. Let's stab at it, right? Most times I end up being the person who has to start them on medications and then send them back to their primary care physician, right? And most times I give people a couple of scenarios. I tell them, one, remember hypertension is a chronic illness, which means it took you 20, 30, 40 years of a certain level of abuse to the body, right? In terms of all the different aspects of your lifestyle to get to the point where you end up in my emergency room with a pressure of 190 and 120, right? I would start you on medications then because I'm trying to prevent the heart attack, which you probably can get in 2 weeks, or the stroke that you probably might get in 3 weeks, right? However, understanding that no medication that I start you on is a cure for this situation. It's only a patch, right? So it's now up to you to look towards now going, just as Dr. Mitchell said, what are the things that brought you to this point? You understand? So you look at your diet, the increase in salt, increase in processed foods, not enough potassium containing foods, fresh fruits and vegetables, and the rest of those. Switch that over. All right. Exercise. You're not accustomed to exercising, right? You're gonna now want to start up with an exercise routine where you start doing 5-6 times per week. You do your half an hour of your aerobic activity. All right. Water intake, rest, management of stress levels, and all of these things. So all of these factors, and in fact, I think the literature actually shows that about 33% of people with hypertension can actually be managed without medications, right? The number is a bit higher for diabetes, but understanding that it's a full lifestyle change and is multifactorial, right? So when you reach that point, you're at the point of crisis already. So now you need to now find yourselves to the professionals like the dietitian, which Shandira we have right there, your primary care physician, your monitoring and everything of that sort. Change your lifestyle. And the thing is this, though, I always tell people, because most times the people who want to get off medications are many times the people who are still not willing to put in the work, right? And I turn to them, I tell them, I say, listen, small changes bring small results. Drastic changes bring drastic results. Are you willing to make that drastic change? So it takes a certain level of dedication. It takes a certain level of commitment. And even though, and that the other encouragement is this though, even though you don't get off the medications today, even if it takes, let's say you're gonna make an aim and you make a goal that is achievable, right? If you say, listen, in the next year, I'm going to change my lifestyle to the point where I can get off medications, it's something that you can do. You just have to be willing to put in the work, put in the dedication, follow up with your physician. I tell them, listen, if you can prove that you don't need these medications, the doctor will be forced to take you off of it. Don't jump and do it by yourself, but go after the changes. All right. I hope that answers your question. Anybody else has anything to add?
Yes, I just want to add more of the dietary aspects to it. Now, of course, our typical Bahamian meal, it promotes almost every type of disease, especially the chronic illnesses. Okay, so of course, we're typically used to the peas and rice, the fried chicken, the macaroni, all of those things. So if you really want to make a change in your health, you have to change that. Okay, we want to get more live food on the plate, more real food on the plate. Stay away from the processed foods. That's anything in the can or package, any kind of how they usually don't really promote good health. So you want to get in the habit also of reading your labels. That's really important to know how much sodium is actually in the food you're eating, because not all food high in sodium is actually salty or may taste salty. So you have to know what you're actually eating. And Dr. Alec also mentioned water. Water drinking is extremely important to keep your blood pressures normal or stabilized. You want to keep your blood, the viscosity kind of thin, so it doesn't cause any trouble or much trouble in your system. And so the main thing, try to eat more real foods and more plant-based foods. Stay away from the animal foods as much as possible.
Okay, Sister Shandira, you're saying to eat more live foods, more unprocessed foods. Can you give us an example of those foods?
Okay, so yeah, so there's fruits, vegetables. Of course, we know what fruits and vegetables are. I'm thinking your whole grain foods. Okay, then when we say whole grain or complex carbohydrates, we're talking about the brown rice, the cassava or our root crops, cassava, potatoes, pumpkin, plantain. Try to eat the plantain, not fried. All right, plantain is very nutritious, but when we fry it, it's not so much healthy anymore. I know we like a lot of corn, but corn isn't the best vegetable to be eating. Corn isn't very nutritious. And of course, well, especially persons with diabetes, I really don't advise them to eat much corn at all because it tends to keep their blood sugar levels high. And anything from the corn and grits, all right? We eat a lot of grits in this country. There's not much nutrients in grits, especially when it's refined. Now, if you want to grow your own natural organic corn and grind it and make your own grits, that's fine. Okay, so you try to have more of course, your vegetables. You want vegetables to make up a half of your plate, a quarter starch, a quarter protein. Once you follow that, you tend to be more in balance and you tend to manage those conditions much better. You get healthier. Okay, so want to make sure that you follow that as much as possible.
Okay, thank you, Shandira. But there's a question on zinc while you're on. What foods can we get zinc from instead of taking the supplements?
Okay, so zinc is found in our nuts and seeds. So the almonds, the cashews, the lentils, the chickpeas. Tofu also has some zinc in it. Other foods like pumpkin seeds and oatmeal or your whole grains on the whole, they have some zinc in it. And especially the nuts. I know the Brazil nuts has a lot of zinc and selenium. So I know and they're the ones that we tend to leave in the bag. But they are really potent and they're very nutritious in those two particular nutrients.
Okay, thank you. Anyone else has a comment on the hypertension question? If not, we will go on to the next question. For men over 40, how do you increase testosterone naturally to keep from losing muscle? What do men need to do to maintain their muscles?
I'd like to say just a little bit about that. If you want to maintain your muscles, the first thing you need to do is to be active. As a matter of fact, God intended for us to be active animals. If you want to maintain good health, be active. If you want to live long, be active. And if you want your muscles to continue to be functional, be active. That's number one. Next, you have to eat a balanced diet. You have to take in good proteins, enough proteins, along with the rest of your nutrients. The muscle is intended to move. And if you keep moving, you're going to keep good, healthy, strong muscles.
Okay, thank you. Thank you very much.
So far as testosterone is concerned and natural sources of testosterone, this question has been a challenge to urologists for a long time, and it still is. Natural sources of testosterone. Most men who are deficient in testosterone have to get their testosterone level raised by supplementation. In my practice, this is done by injections.
Mhm.
Now, there was a time when we gave testosterone tablets. You can hardly find testosterone tablets anymore because we now know that taking testosterone orally, that is by tablets, can eventually cause problems with the liver. So we don't do that anymore. Giving it by injections is safe and it works. We do it all the time.
Can I just add a bit? Is interesting because it's the balance is a very important thing here, because in trying to determine what causes testosterone to decrease, a lot of the study shows that extra cortisol in your body causes testosterone to decrease. Extra weight in your body causes testosterone to decrease. You understand? You know, extra fatty foods and those things causes testosterone to decrease. So many times in terms of maintaining your testosterone, you now have to figure out what are the things that I'm doing that are causing the testosterone to drop. So if you have a ridiculously high stress level or stressed out life, then that probably may be the reason why your testosterone is decreasing. If you are, so you're not getting enough sleep at night, it will mess with your testosterone levels because it causes an imbalance between cortisol and testosterone. If you don't do regular exercise, which is going to decrease your body fat, you're going to end up with lower testosterone levels. So honestly, all of these things reflect right back onto the healthy lifestyle. I mean, I know there are studies they did on things like ashwagandha root and those things in terms of, there are smaller studies that probably show that those things may help to increase your testosterone level by a small amount. And, still not too sure what the reliability of those studies are and how large they are and further studies that were done on them. But really, a lot of it has to do with our lifestyle and being able to live a balanced lifestyle.
Okay, everything is going back to lifestyle.
Can I add?
Certainly.
Also, Dr. Evans mentioned protein, and sometimes people think when you say protein, you mean meat. And so it's important for us to know that, the big animals like gorillas and elephants get their protein from plants. Plants are excellent source of protein, the best source of protein for us. And even if you're trying to build muscle, you'll see that elite Olympic athletes are now turning to vegan diets to improve their performance. So don't think that you have to eat meat when we say you need protein to build muscle. You need an excellent whole foods plant-based diet to do it optimally, because excessive animal protein will adversely affect your heart, your kidneys, and other important structures.
Okay, thank you so much. Next question. Why do older women still have hot flashes? Now, this person did not state an age. I guess 16 above, I don't know. Why are older women still having hot flashes, Dr. Vanessa?
She's trying to go above her age, right? With defining what old is.
I'm not there yet.
It's interesting. When you talk about hot flashes, you're talking about, generally speaking, a decrease in estrogen, and that decreases with age. However, if you look at Oriental populations who eat a lot of tofu, a lot of soybean products, they don't even have a word, or they never used to, I don't know if they do now, for hot flashes in their language because it didn't exist. And so you can reduce your risk of hot flashes by increasing soy products. And it's important to know that there is controversy about whether soy products are good for you or bad for you, but the studies are indisputable that soy products are good for you when you use them in a healthy fashion. And so soybeans, edamame, organic soy milk, tofu, all good sources of soy and good ways to reduce your likelihood of hot flashes. However, when people are artificially put into menopause, it seems like it is more difficult to control the side effects of, because that is such a drastic, not the natural way that our bodies are designed to see that hormone go. So anytime that men interfere, not men in gender, but humans, interfere with what God has made, then we find that there are problems. And I've noticed that when people are artificially, you know, when the ovaries are removed, and so they're artificially put into menopause suddenly, that they have a lot more difficulty with the hot flashes.
Okay, thank you so much,
Can
Dr.
I,
Vanessa Shaw.
may I add?
Certainly, Dr.
add
Hicks,
something?
welcome.
Okay, yes, thank you. Also, becoming a vegetarian at an early age also helps with that. And I can speak for that myself because I started this lifestyle, because that's what it is, from about 22, 24, 25, somewhere up in there. I didn't have any menopausal symptoms, no hot flashes or anything. Other persons that I've consulted with over the many years, advising them to make that choice of a lifestyle change, they too have a problem. Didn't have any problem. But what to do, you can also add sweet potato, you know, the yam, sweet potato, make that as a part of your diet as well. I'm not gonna go over the foods because Shandira did a very good job listing them and you've heard them over and over again. So I'm just saying adding more sweet potato, the yam. I'm going to say this about the water now, drinking water. Make sure you're sipping on your water or you're taking mouthfuls at a time. Let it mix with the saliva in your mouth. Don't just swallow the water right down. Mix it with the saliva, 2-3 mouthfuls at a time. And that will also help because the cell seems to absorb more water that way. Other than that, we need to eat our water. Let your food be your medicine and your medicine your food. So eat foods like your grapes, your cantaloupes, your cucumber. I'm just spreading them out, but you put them together for breakfast, lunch, etc. All these foods have high content water, like 96% water, 93. These are the things you want to add as well, especially as you're going through menopause.
Okay, thank you so much, Dr. Hicks. And you just came in, so please tell our persons on the platform a little about yourself in about a minute. You had introductions before you came in.
Oh, yes, we had problems at home, so I'm someplace else and I cannot even use my camera. But anyway, yes, I'm Elvira Higgs. I'm a naturopathic doctor. I had, I guess, in my teens, acute blood disorder. I've got that from 2 or 3 doctors. And in short, all the medication that I took, problems that I had with my skin, etc., from doctor to doctor for about 5.5 years, I finally ended up to a skin clinic in New York because then the poisons and toxins were coming, you know, my skin. And it was there that I was told to drink more water, to eat plant-based foods. As a matter of fact, the only thing that was recommended for me at that time was vegetables. Now, he didn't say what type of vegetables, and I didn't know, but he just said vegetables. I stuck to that because I wanted to get well. I was like the death's door. And going to New York with my sister, I guess, was the last straw. They figured they have to take me someplace to make sure that something is done. In about 3 months, I came home and my appointment was I went back to New York. So that was about 3.5 months. I should have gone back for 3 months. They told me that from the results that I gave myself a blood transfusion. My brother-in-law, who said I was playing around with these doctors, he wanted to take me to a real doctor. So the real doctor, we took all the lab reports and everything, and he was shocked. He wanted to know what I did for the past 3 months. So basically, that was my lifestyle change. I was not even an Adventist then. And here I am now, 49 years later, still on my vegetarian lifestyle.
Wonderful, wonderful. That's the original diet found in Genesis 1:29. Okay, a question for Dr. Mitchell. Dr. Evans, you're saying something?
No.
Okay, Dr. Mitchell, a question for you. How do you deal with ingrown toenail? A lot of people have ingrown toenail and you see them picking at it and clipping and, you know, How do you deal with it? Should someone like that come to you?
Yes. So yes, another common foot complaint is ingrown toenail. So an ingrown toenail is when the nail plate is the little plastic looking part of the nail, when that grows out into the side of the toenail. And very common, it occurs because the nail was probably cut badly, meaning they cut down into the corner of the nail, or sometimes it can happen with shoes, the type of shoes you wear. If you're wearing tight shoes, especially pointy mouth, in young boys as well is very common because they like to wear their sneakers tight. And so anything that puts pressure on the toenail can actually cause an ingrown toenail once the nail is cut in a way that when there's a spike or a little piece of the nail that's left. One of the other things that that what person should do about it is, so it could be just from a simple, little redness, pain in that area. It can go straight to where they have pus and a granuloma or a very swollen nail, and can be very, very painful. So most often then I would see the person in that condition. But before that, there are a lot of things that you can do to prevent an ingrown toenail or to actually treat it at home. So to prevent the ingrown toenail, we like to say cut the nail straight across. If you look at your toenail carefully, you can actually see a line at the end of the toenail. That is where God intended that the nail should be cut. Okay, so not shorter than that, and definitely not cutting the corners rounded or pointing out or into the corners, because they will definitely lead to ingrown toenails.
Okay.
Some persons are at higher risk for ingrown toenails. Those persons would be like with fatter toes, even pregnant women, because of the hormone level, they would tend to have more ingrown toenails. But if it gets to the point where it's painful, one home remedy persons can use is to soak the toe in vinegar, the white vinegar, for about 5 or so minutes a day. And this is not for diabetics, for persons who are not diabetic. They can soak it in that, maybe like a quarter cup in 2 cups of water, and just soak the toe in that, and it will actually help with the ingrown toenail. If it persists, then it's time to go and see your primary care doctor, who may be able to order some antibiotics, or it may be time to come see a podiatrist who we will fix the ingrown toenail permanently by taking out that corner of the nail and putting some medication in there so it doesn't grow back. Thank you.
Okay, thank you so much. Dr. Evans, this looks like a question for you, or anyone else can chip in for that matter. What can men do to prevent and also manage/reverse prostate cancer? It's very prevalent here in the country. What's causing it?
Yes, prostate cancer is very common in the Bahamas. As a matter of fact, prostate cancer is very common in most countries where there is a significant population of Black men. Prostate cancer, in my experience, and I do believe, is preventable. Like I believe that most cancers are preventable. So how do you prevent prostate cancer? Well, let's take a look at what research has told us. The United States government has spent millions of dollars researching this question. What causes prostate cancer? The government in the United States has been able to come up with only one answer. And the answer is, if you eat a high animal fat diet, you are at risk for developing prostate cancer. So what should you do? It's simple. Don't eat a high animal fat diet. Mm-hmm. Now, there are men who think they can do otherwise and have proven over the years that this is indeed a very risky factor. In the 1800s, it was proved back then that animal fat has something to do with all cancers. Around 1950, it was proved, and there was a way to do this. It was proven at that time that if you get rid of the unhealthy fats, which come from animals, get rid of them in your body and flood your body with healthy fats, specifically the omega-3 oils, you get rid of cancer, including prostate cancer. So this is not really a theory. It's been proven over and over and over again. So my first advice to anyone who wants to avoid prostate cancer is, if you're eating an animal-based diet, get off it. Put yourself on a plant-based diet. Now, I want to mention a little something here. Most folk who know me don't know something I'm about to say. On January 29th, 1999, on that date, I received some lab results on myself. One of the shocks I got was my PSA was high. The PSA is a blood test for prostate cancer, and mine was high, and I'm a urologist. So imagine how I felt. Well, I made a decision about 10 seconds after seeing my results. The decision was, don't eat meat. And I just want to say, from that day to this, I have not eaten any meat, and I'm still here talking with you today.
Wonderful, wonderful. Wise decision, wise decision. And everything points back to the original diet.
That's right.
Well, you know,
diet.
there's something interesting about that.
Mhm.
One of the things that I noted is God in the beginning made us.
Yeah.
So he knew what was good for us.
Mhm.
It is interesting, I think, that in the very first chapter of the first book of the Bible, God tells us what to eat. Now, if we eat a plant-based diet as he recommended, we'll be healthier, live longer, less illnesses. If we become ill, we recover quicker. If we go into the hospital, our hospital stays are shorter. If you have to have surgery, recovery and healing is quicker and faster. Interestingly, too, the very last chapter in the very last book of the Bible tells us, even if you get sick, get back to the plants. That is where your healing is. Very interesting.
It is, and it's true. It's been tested and proven.
Sister Nat, what we are sharing here this evening, a lifestyle change prevents, reverse, and maintain. And when we're talking about reversing, that's all of the diseases. I know Dr. Alec and those going to say something else, but unless you're in an accident, even if some folks, they inherit something, because I think that's what they said about me. I inherited that from the Thompson side of my family, because another sister, we are the same father, had the same thing later on. So even if you inherit it, once you change your lifestyle, you're on the way to good health. And I mean, keeping it that way. Earlier, Dr. Evans, when I had to leave home because of the no electricity, when I got in here, Dr. Evans was talking about, you're talking about high blood pressure, Dr. Allen. You look at high blood pressure. The most simple and effective thing for high blood pressure is coconut water. That's the natural coconut water. So those of you there in Andros, you should be sending us some coconuts here, please, okay? Coconut water. The second best is onion and water. Just a small, tiny onion. If you put your pointing finger to your thumb, make a circle, you would need about a half of that in 8 to 10 ounces of water, and you drink that every day. I would say put it in 32 ounces of water. Why? Because you need to drink one first thing in the morning, room temperature, before lunch, and the last thing before bed. That's your onion and water now. Then folks are talking about diabetes. One of the simple and most easiest things I found dealing with my mother was okra. First, she did not like the slime, but the slime is the best. After I got her to start drinking the okra and water, I would blend 2 cups. If I put in 2 small okras, 2 cups of water, we would pass the slime. Then I started putting in less water until I just steep it in the water overnight and have her drink that the next morning. She got off her medication using those things. We've got prickly pear, or what do you call that other one with the needles? Put that in hot water. Make sure you get it harvested properly. All the needles would numb. Peel the skin off. You can chop that up. You've seen people make conch salad before, just like the conch salad. That would replace your conch. Put everything else in there, and you eat that on a regular basis as well. If you want to bread it, season it, bread it, you can bake it. I don't fry, but some people fry it. All of these things are good for the heart. They're good for the liver, the kidneys. So these are the things that we have that can maintain health. So if you don't have the lettuce and the fancy things that we have here on the islands, don't worry. You've got all the things right there, your cocoa plum, your pigeon plum, grapes when they're in season, tamarind, all of these things, the Lord put them there for a reason, and they're seasonal, for a reason. So you just eat them during that season, like they're going out of style, and you'll see that you'll get different nutrients here again to maintain health. Thank you.
Okay, thank you so much. And of
I'd
course,
like to add another word about that question on preventing prostate cancer. Some men feel that they are naturally prone or will naturally get prostate cancer because they think they inherit prostate cancer. If a man's father, brother, or an uncle have prostate cancer, that man has a very increased risk and chance of getting prostate cancer. But it is not inherited. And I want to emphasize that. It's not inherited. Well, how come it runs in families? How come a man is so much more prone to it if his near relatives have it? Well, the answer to that is they are likely eating similar foods, living in a similar environment, living a similar lifestyle, and have similar exposures. That's the reason. It's not that you inherited the cancer. No, it wasn't inherited. It's your lifestyle. Change your lifestyle and you change your chances of getting it.
thank you so much, Dr. Evans. And I'm happy that you said that, because a lot of persons, they have this thing that it's in my genes. And so I'm going to get pressure, I'm going to get diabetes, so and so. But it all boils down to lifestyle choices.
One of the things many of us are not aware of concerning this thing about genes. Now, I know the University of Miami did a big study in the Bahamas about the breast cancer in women, and their conclusion was they blamed it on the genes. Well, I beg to differ. You see, most of us don't realize, and even many scientists are not aware of the fact that genes can be stimulated, they can be depressed, they can be modified, the effects of genes can be changed. One of the best modifiers for genes, especially when it comes to cancer, is vitamin D. Every patient, every single one that I've seen thousands of men over the years with prostate cancer. I have never seen one who was not deficient in vitamin D. And the same goes for women with breast cancer. I've never seen one who was not deficient in vitamin D. Incidentally, concerning this thing about eating meat and what have you, I've never seen a prostate cancer patient who did not eat chicken. And I've never seen a breast cancer female who did not eat chicken. Now, if you know of one, let me know. I'm still looking for the first one.
Okay, thank you so much. Thank you so much. There's another question from
Not before you go on.
Okay, go ahead, Chandira.
Before you go on, I just want to add in reference to the prostate cancer. I know in Jamaica they did a study this some years ago, and they found out that men who ate a lot of salt fish, they actually had it actually increased their risk for prostate cancer. And also other studies show that a high intake of dairy foods actually also increase the risk for cancer. So that's dairy and the salts. We really have to be careful of those in our diets. And of course, we know macaroni and cheese is one of our staples. And we like to drink or use a lot of cream and different dairy products. So we really have to ease up on those. So we can actually decrease our risk for, or men can decrease our risk for prostate cancer and also women for breast cancers.
1 second. Okay. All right. Okay. Thank you, Chandira. Thank you so much.
Yeah, that was the Berkeley study. Oh, I don't know if you want to just drop in that study with the cow's milk was the Berkeley study. I think it was 2015, and they were talking about the association of that with breast cancer, especially because of so many things. One, the cow's milk itself. Two, the fact that the cows were being even milked while pregnant. So all of this led to increased amount of estrogens and stuff in the cow's milk. But Dr. Evans is right with respect to the fact that you may have a loaded gun, but something has to pull the trigger, right? And that's really the principle there, all right? And whether the thing that pulls the trigger is a poor diet, whether the thing that pulls the trigger is very high stress levels and high circulating cortisol and stuff, whether the things that that pulls the trigger is environmental factors, something pulls the trigger. You understand? So that's why lifestyle is a full and total thing, right? It consists of many factors, and you have to go after it. I mean, even with respect to the milk situation, I always tell people when we have the conversation about milk, I tell them, I say, listen, think of it. I said, and in summary, the quick and dirty summary is this: breast milk turns a 5-pound baby into a 10-pound baby at 3 months and into a 20-pound baby at 1 year. So human breast milk contains the growth factors, the building blocks, the stimulants to double a baby's weight in 3 months and then double it again in a year. Think of cow's milk. It takes a 15-pound calf and it turns it into a 500-pound cow in a year. What's that factor? That factor is 30 or 40 times, right? So now you're saying that naturally speaking, cow's milk has the growth factors, the building blocks, and the stimulants to be able to, multiply the weight by a factor of 30 or 40 in the space of a year. So when you take something that's not designed for a human and you put it into a human, one of two things is going to happen. Is either you're going to actually run with it and it causes that acceleration, which, I mean, if you really get that amount of stimulus on regular human cells, what it's going to turn into, right? Or the body may choose to reject it. And then we have all the other problems that develop there in terms of, autoimmune issues and rejection. You're talking about, think of it, mucus buildup, sinus. What is it that they tell you to stop drinking, right? Migraine headaches and the rest of those. What is it that they tell you to stop drinking? You understand? You get the point there, right? So we do have to think of design. We do have to think of, and we as human beings were designed to eat plants. And we were designed to drink human breast milk until a certain age and then stop. I'll leave it at that.
Thank you so much. There's a statement coming from the chat. There are many diabetics in the family island. Is it possible to set up a clinic on the island to treat leg and foot problems for a small fee? I think that's directed at Dr. Mitchell. Another question. Oh, go ahead, Dr. Mitchell.
Yes, good afternoon. We would have to look at the possibility of doing it, but I'm sure we can arrange something either through our government clinic there or privately. So I'm not sure who that is, but they can give me a call or email me later, and then we can try to work out some details.
Okay, so can you put your contact in the chat for us, please, Dr. Mitchell?
Okay, I will.
Here's another question. Thank you.
Before you go on to that other question, Nathan, I'd just like to say that those people with leg ulcers and other complications of diabetes should also be doing the whole foods plant-based diet to reverse their diabetes, to heal their ulcers faster, to prevent worsening of those complications. So it's not just a foot clinic that you need, but you also need a lifestyle clinic.
Definitely. Just let me iterate at this point that the information that is being given here on this platform this afternoon is in no way to replace medications. Those of you who have already been diagnosed with issues, we want you to be responsible, speak to your doctor, and in conjunction with lifestyle change, as your numbers lower, the pressure, the diabetes, Your doctor is honest. They will lower your dosage of medication and eventually take you off. But we don't want you to go after this program and say, hey, I'm not taking this medication. I'm not claiming this and all that stuff because you're already there. Be responsible. Take your meds in conjunction. As you get better, the dosage get less, and eventually you come on. Okay? All right. What about arthritis? How can we get rid of this horrible disease? What food should be avoided and what should be increased? Speak to arthritis for us, please. And what causes arthritis anyway? That's for all of you. Who can speak to it?
Okay, so I guess I'll start off since you asked about food as well. And so arthritis is an inflammatory disease. And so you want to eat the foods that would prevent or address inflammation. And of course, it would be more of the plant-based foods. So you want to avoid excess sugar, especially white sugar, refined oils. You know, the oils that we normally use in the Bahamas, they're actually inflammatory oils. The corn oil, the vegetable oils, the canola oils, all of those are pro-inflammatory oils, okay? So when you're using it or when you're choosing your oils, they should be unprocessed oils, extra virgin, unrefined, or speller pressed or cold pressed. All right, so if you don't see those names on your oil, that's not a good one to use. Okay, also there are certain vegetables that may, they call them nitrate vegetables, like the potatoes, the eggplants, even onions may aggravate the condition more, so you want to avoid those ones. And so you want to choose more fruits, more berries, herbs like garlic, particularly ginger, turmeric. There's also cherries that help to relieve arthritic pain. And there's also organic apple cider vinegar with the mother. Of course, you don't want to use a whole lot at a time, maybe like a tablespoon to about 8 ounces of water, maybe about once or twice a day. It also helps to relieve arthritis pain.
Okay, anyone else would like to?
And there's exercise also. You just can't keep still, you have to move. Somebody mentioned our bodies were made for movement, so you have to move as well. Even though you may feel pain, movement actually helps to heal.
Yeah, I was about to add that, but definitely you need to move. And one of the good ways, or a good way to move, is to do it in the water, in the sea, or in a pool, because that is considered non-weight bearing. So it's much easier on the joints and for the pain. But with arthritis, you definitely need to keep moving, and so that you can reserve or preserve whatever joint function you have, and to slow down any progression of the arthritis. So move to live.
Yeah.
Thank you, Dr. Mitchell. One little plug in here.
Okay, Dr. Higgs.
I was going to mention about walking in the sea, because the ocean is loaded with minerals. So while you're exercising, spend some time just walking. Make sure your feet is protected, however you want to do that. You start with the water first over your ankle. Map out a distance. You're going to walk from point A to point B right here, short distances. Then the water needs to come up over your knees. Once you start walking again that distance, you're going to feel then the muscles in the back of your leg all the way up to your back. You do that, keep going out in the little distance in the ocean. The water then comes up over your waist. And then you're going to have a little more challenge in lifting the legs. You're going to do that a while, and then the water is going to come up over your shoulders. Now, this is where you want to relax. If you can swim, then you swim. If you cannot swim, then you just play in the water. This is very, very beneficial, because you will be entertaining Dr. Air, Dr. Sunshine, while you're in the water. By the time you come out, you're going to need to drink some more water. Remember now, the body starts to deteriorate when you have acid. You have the acid in the body, then the acid turns to inflammation, infection. You have more acid, and then some scientists say wherever is the weakest part in the body, that's where most of that toxins or poison would lodge. Okay, so you want to make certain, Dr. Evans mentioned it before, because some of the problems that we're having, and even with diabetic, is too much uric acid. And we get that from eating more of the chicken. Thank you.
Okay, the good old chicken, good old.
There's a
Okay,
little there's a couple of things too. I mean, one, understanding the difference between osteoarthritis and rheumatoid arthritis. Osteoarthritis being more of a chronic degeneration, wear and tear type of issue, happens to older people, versus rheumatoid arthritis, which is autoimmune, and there are associations with that, with inflammation and with even certain bacteria. There are some studies that even relate the E. coli residue from processed chicken, actually, and and joint disease in, it relates it with UTIs in women and joint disease in women too, and it relates it in some way to rheumatoid arthritis and some arthritic conditions too. All right. Honestly, from the inflammatory point of view, a plant-based diet is very much associated with decreases in all of those conditions. It's kind of that simple. All right. But the key to understanding arthritis is to really be able to sit and discuss with your doctor and really go through your entire history of determine which type it is, determine how it came about, and determine how to approach the treatment of it. All right. So it's something that you should be able to, you should seek professional advice from, and sort of go through it in a step-by-step process to determine what it is that you have and how should you approach it. Okay.
Okay, thank you so much. For cholesterol issues, what can persons do to prevent and also eradicate cholesterol issues? Elevated cholesterol. I think that's an issue that comes as a result of eating.
Well, I'll tell you what I advise my patients, how I advise my patients about it.
Okay.
In our environment here in the Bahamas, a high cholesterol level is very common. We run into it every day. But why? Why is it so common among us?
Mm-hmm.
Here's what I tell my patients. If you have a problem with high cholesterol, for most people, you need to know only one thing. And if you know this one thing, you can beat the problem. First of all, why is it that if you have a high cholesterol and you're put on medications, why do you have to take the medicine for the rest of your life? The answer to that is you take the medicine because you still have the problem. You have the problem for the rest of your life, but you don't need to have that problem the rest of your life. All you need to know is one thing. And that one thing is, where is the cholesterol coming from? And cholesterol only has one source. If cholesterol has only one source and your cholesterol is too high, why not just do something about the source? Well, most people don't know what that source is. So what I do, I educate my patient and let them know what that source is. The single thing that you need to know about cholesterol is that it only comes from animals. Cholesterol only comes from animals. It's the only source of cholesterol. Absolutely nothing that grows from God's earth has any cholesterol in it. So if you eat only things from the earth and don't eat any animals, you beat your cholesterol problem. That's it.
Ella, you saying something?
The other thing I would add is exercise, because there are two types of cholesterol that we know about, the lousy LDL and the healthy HDL. You want to make sure that you have a high HDL through exercise and a healthy plant-based diet, and a low LDL by avoiding animal products in your diet. So exercise goes along with that diet.
Okay, thank you so much. I'm seeing in the chat, someone is asking, how safe is coconut water to drink every day? Is it safe to drink coconut water every day? I guess so, in moderation, hey.
I was just about to say, depending on how much coconut water you're drinking.
Mhm.
Yes, but yes.
I would say if they're drinking anywhere from 3 to 5 cups a day, that's safe. Here again, that's natural water from the ground. It's loaded with vitamins and nutrients. And I know we don't have the time to spell all of them out, but you know what we mean. It is loaded. So coconut water is very safe.
Okay.
As a matter of fact, it contains a lot of oxygen as well. One of the things in Arizona, and of course they had to import them too, at their cancer camp, what they did was in the morning, their patient would get a gallon. You'd have a gallon of water when you check in. That's Sunday. And you start drinking it that morning. So you would drink anywhere from 2 to 4 cups of the ocean water, and they tell you how they tap it, how they get it. And in between that, you're drinking then your coconut water. That's for the first 2 days. And then after that, they start tapering you off. What we found was that persons who even started with just the ocean water for about 2 days, not even getting the coconut water, you can tell who went to the bathroom, which area of the building. And most of you are familiar with UC Pines. If you at one end and you open one door, you could actually smell the odor. That's all the dead, cold mucus, etc. But what we found was when the folks are drinking the coconut water, there are 3 to 5 cups of coconut water a day in between that odor is kept down. Coconut water works with all the minerals. When you check their lab report again midweek, because they did it the Monday and they would do it the Thursday. I don't know how I'm getting midweek there, but that's a Thursday. And you would already see a difference on those who opt to do the ocean water and the coconut water.
Can I just drop in a little bit to this, right? I'm always a bit cautious when people say, just say, give across the board question of, is it safe? All right. So coconut water has sodium, it has potassium. In fact, if you compare, coconut water has a little less sodium than, let's say, if you benchmark it against, for example, WHO rehydration salts, right? Coconut water has a bit less sodium than the rehydration salt. It has a bit more potassium than the rehydration salt. All right. I would still caution that we should not necessarily use anything really as a replacement for pure, fresh, clean water. All right. So you should make sure that you have an intake of water. Do not use coconut water to replace all of your water intake. All right. So it is safe, yes, but in a certain degree of moderation. Coconut water is classified as an electrolyte in this case, right? So you're talking about something, and I'm not saying it is the same as, but those the drinks that the athletes would drink. You understand? Not calling too many brands or so to get myself in any problems, but be aware that coconut water has sodium, it has potassium, and it is naturally occurring. It is better than a lot of the other electrolytes. But for example, people with kidney disease, you can't drink too much coconut water because of the potassium content of it. Understand? People with diabetes, there is some glucose in coconut water too. So if you drink too much, it can also bump up your blood sugar a bit too. Okay. So within reason, coconut water is a healthy drink, and it is something that can be consumed in small amounts every day.
The other thing I would want to add too is if you are buying your coconut water from the store in a can, read the labels and you have to know what's in it. Yeah, so we're talking about coconut water from a coconut tree right now when we're talking about how good coconut water really is.
Okay, thank you so much. A question from the chat: is coconut oil safe for cooking, and does it impact cholesterol level? Is it safe to cook with coconut oil? And how does it impact cholesterol levels?
I'm gonna drop a little bit on this and then hand over to the dietitian, right, Chandira. But the principle I would tell people is this. Very little oils are safe when you heat them. All right. So the principle here is coconut. And okay, so if you think of coconut, olive, and the rest of those oils and stuff, you can actually read up on their different levels of heat stability and everything of that sort, right? Then you also think of the short chain fatty acids contents and those things. Fine, yes. Coconut water has a certain level of safety when used in small amounts, and actually the safest coconut water is the fresh pressed. I mean, coconut oil rather is the fresh pressed, which is the one that was not heated. All right, that's the one where you can even make that right at home. It was ground down, left to sit for about 48 hours, and the coconut water just rises. The coconut oils rather just rises to the top, right? But by principle, oils should not be heated, and superheated oils actually turn them into inflammatory substances. All right, so that's the principle that you should take home. Chandira, go with the specifics now.
Actually, you basically said what I was going to say, so that's fine. The important thing to do is remember not to, as you mentioned, not to overheat your oils. Or even last night I mentioned, I did similar last night I mentioned about when, of course, coconut oil is something that we use on the islands a lot. And when you actually cook it to produce it, that actually kills a lot of the nutrition in it, and it actually adds toxins to it. So you want to make sure, as you mentioned, about using the cold way to produce it. So when you grate it and strain and leave it to sit for 48 hours, you see the oil go into the top. That's the way to use the coconut oil. So if you use it any other ways, it has the potential to actually cause health problems or health issues. And those other oils that we use too a lot, as I mentioned earlier about those, the corn oil and those other oils, all of those can potentially cause your cholesterol to go up. And also a diet high in sugar, especially refined sugar, can also increase your cholesterol levels.
Okay, thank you. There's a question for Dr. Miller. What are fibroids, and what can we do to prevent getting fibroids? There are a lot of women here in the Bahamas with fibroids. Can you speak to that for us, please? What is it, and what can we do to prevent it?
Yes, fibroids are benign growths that occur in the uterus. They can occur inside the cavity of the uterus where the baby is, or they can occur in the muscle of the uterus or in the outside covering of the uterus. And fibroids are what cause you to have very heavy periods, because they tend to attract a lot of blood vessels, and they require blood in order to continue to grow. So animal products stimulate the growth of fibroids. People who follow a plant-based diet for their lifetime have a very, very low risk of developing fibroids. And if you do have fibroids, and you catch them early and you can convert to a plant-based diet, you can prevent them growing. Once you hit menopause and you are no longer producing the hormone estrogen, then the fibroids will actually shrink. And so if you're eating all of this chicken that has been fed artificial hormones, we're saying chicken, but there's beef and all sorts of other stuff that's fed these artificial hormones, you're actually promoting the growth of your hormones, the growth of your fibroids. And so what we've been saying all day is the same. And I'll say right off, the plant-based whole foods diet is the same diet that will prevent breast cancer, colon cancer, prostate cancer, fibroids, diabetes. God knew what he was doing, as Dr. Evans has said, and we can trust what he has said. He said, I will not put all those diseases on you if you follow this way. And it's only one way. It's not a separate diet for each thing. It's just one thing. He made it so simple for us.
Thank you. Thank you. So we just need to follow the blueprints. I can speak to that. Next
So that,
question.
Sister
Okay,
Nat,
go
before you
ahead.
go on to the next
Go ahead,
question,
Sister.
I was sort of mention too, in addition to being on a plant-based diet, we have to make sure you choose more whole foods. Okay, so I realized, because I had an issue with fibroids as well, and I was having a lot of vegetarian meats that had isolated soy protein or concentrated soy protein, and I realized after hearing what's the doctor from Nutritionists name? I can't remember his name right now, but he spoke
Sandoval.
about that. Yes, and I finally made the link. So I was trying to figure out why. So you would watch out for those refined soy or even any other kind of refined foods. So make sure to stick about a whole food plant-based diet.
Okay, thank you. Thank you. Is radiation and chemotherapy treatment needed for stage 4 cancer, or can natural remedies work? Someone has stage 4 cancer. Is the only thing that can help them radiation and chemo, or can this plant-based diet that you guys talking about, can that help the person? And also the walking and getting enough rest and drinking water. Let's speak to that. All of you can speak to that, I'm sure.
Okay. Okay. As a student worker at UT Pines, I found out that stage 4 cancer can actually be reversed. And this is not for everybody. Like what we are saying here this evening, it doesn't work for everybody. You have to first put your trust in God and realize that he says, I am the one that healeth thee. Accept that free gift. And then we start with the physical part of it. I've actually seen, witness, help, was a lifestyle counselor to several persons with stage 4 cancer, and by time as they left, then it was 3-week sessions. By time as they left for the 3 weeks, our last lab report shows that the cancer was in remission. I've worked with a lady who had liver cancer. She came and I think, well, she looked as though she was about ready to have a baby. And I was thinking that she came there because some folks came to Dr. Agatha who took care of them, privately. And I'm wondering why she was at the center. And after the second day, she was assigned to me. And I'm saying, Lord, have mercy. But anyway, even with the liver cancer that she had, and they said that the liver then was either stage 2 or stage 3. I don't remember exactly which one. But here again, it was an eye-opener for me. Brother Ozzy talked about the fermentation last night and the heat, the hot and the cold, putting her in most of you would know it as a jacuzzi. We would call it a whirlpool. And actually rubbing or massaging that area after I put her to bed. And I saw these things coming out of her pores. It looked like little worms. I too was frightened. But I realized after we went to medical conference the next day and was sharing the information that here, this is the body was actually pushing out a part of that tumor that would have been broken up over that week. And this is like this, the Monday of the second week. And when she left, here again, they said she was cancer-free. But you have to maintain that lifestyle. And it's the same thing we're sharing, the 8 natural laws of health. That's including everything. There's no one thing that causes a disease, and there's not one thing that can reverse or help you with the disease. It's a combination. God is good because no one person is going to get the credit to saying, oh, I heal this person or I help that person. The 8 natural laws of health, together with your faith in God, can reverse. Now, here again, like I said, I was there, and several persons who came, their stage 2, 3, nor 4 cancer went in reverse. So it depends on the individual.
Thank you so much, Dr. Higgs. Thank you. Thank you so much.
Yeah, I'd like to say just a couple of words here. When we talk about stage 4 cancer, we're talking about advanced cancer. In many cases, stage 4 means a death sentence. Now, let's face it, that's serious, serious stuff. Stage 4 is advanced as the cancer can get. And oftentimes we doctors talk about a patient being terminal, meaning he's facing death because of having stage 4 cancer. Well, I believe that God can reverse anything at any stage, including cancer. So I advise my patients, if you have stage 4 cancer, what's the first thing that you should do? I think the first thing you should do, if you haven't started, you should start praying. I believe that prayer changes things. I've seen it happen so many times. If I didn't want to believe, I'd have to believe it. So prayer is an integral part of treating cancer, especially advanced stages. I have seen patients brought into me who literally could not eat, could not walk, patients who were brought in the arms of their family and laid on my examining table. What in the world can you do with a person who has cancer that far gone? I've had such individuals come to me, and I've had those same individuals drive their car and walk into my office years later, not coming in for a checkup. They came to check on me to see how their doctor is doing. So yes, it is possible to reverse stage 4 cancer. Now, each case is different. Each person is different. The response in each person is different. And if God's decision is for you to live, you're going to live. And if it's God's decision for you to go to sleep, you're going to go to sleep. Now, I just want to say one more thing that's important, very important. If you have a chronic or any serious illness, remember this: it is difficult to live if you want to die. And it is difficult to die if you want to live.
Thank you. I like that echo, you see. Listen, now, let me tell you something, right? I'll be frank with you. I'm a physician. I practice medicine. I practice allopathic medicine. I'm licensed for a certain thing, and so on and so forth, right? I practice under my license. Here's what I would tell you about this. In many of the top centers, let's say, for example, in the US and the rest of those and everything of that sort, where you have certain outcomes that may be better than other outcomes, is because they employ a more multifactorial approach than somewhere where, for example, the only support you get from that center that is treating you is that of just the medical. You understand? And it falls back into all of these things. See, remember we started off the message this morning with Proverbs 18 that says death and life are in the power of the tongue. There's science that actually shows that people with higher levels of religiosity, and that's how the science actually terms it. People have, with highest level of religiosity have a better outlook on life, a more positive affect and everything of that sort, and because of that, they have less disease. It's because positive thinking leads to the body playing a part in its own healing. You understand? And so therefore, that's how prayer comes in. Because don't forget, the same thing, it's our choice. You understand? God ain't going to force healing on you if you have told yourself that you're going to die and nothing else you're going to do but die. You understand where I'm coming from? Right? That being said, it goes right back to every case is different. And what I would urge anybody who has or has loved one with stage 4 cancer and so on and so forth, get as many factors in that person's life addressed as possible. You understand? So you follow with your doctor from a medical point of view, but you also need to go after counseling. You need to go after family guidance. You need to seek counseling from your clergy and your spiritual advisors. You need to seek the Lord in prayer. Put everything there out there, because stage 4 cancer is the highest stage of cancer, and it's the point where the cancer has now overwhelmed, in most cases, the body's systems and ability to fight. So at the end of the day, this is the time you need to be pulling out all the stops and unleashing everything that you can on that cancer. I don't know if that makes sense to anybody. All right. But just understand it. It's not just a simple question as to chemo and radiation versus lifestyle change. In most cases, it is very multifactorial. Seek counsel as much as you can from all the different practices and the different disciplines. And also, most importantly, seek the Lord and have a positive attitude.
Some good sound advice. That makes a whole lot of sense. Let me just read the statement coming from the chat. Some physicians don't believe that many diseases can be healed. However, those physicians who don't believe in healing will say the disease is in remission. Those who believe will say the disease has been healed. Okay, so that's just a statement coming from the chat. You know, according to our 2019 STEP survey, and from what I can remember, and Dr. Monique, you can correct me if I'm not right with the figure, we are overweight/obese. I think I saw the stats was about 75%.
78.9%.
79.
78.9%.
78.9%.
Yes,
okay.
both sexes, overweight and obese.
Right.
Rounded off to 80%.
Yes.
Yeah.
8 out of 10.
Up to 80%. Okay, so 10 people in the room. How much fat? How much overweight?
8.
8. We are in trouble because being overweight/obese is one of the biggest risk factor for all those NCDs, Dr. Ali.
Mm-hmm.
Panelists, can you tell us what to do to get this weight under control and to get it off? People are ending up with diabetes and their lifestyle, the stage, the diabetes too, type 2. It's lifestyle choices. I see a lot of young guys under the age of 30 en route to work. They 1 and 2 legs, if they're amputees, they're becoming depressed. They don't want to live anymore. They cannot perform sexually. What they say to me, what's the point in living if I can't, perform? Speak to us about that, please. We're in trouble. We're in trouble.
Okay, let me say this. I toiled with that question for many years.
Mm-hmm.
It was a problem. How do I advise my patients to get rid of this excess weight? How do you get your pressure down? How do you get your sugar level down? How do you get rid of all of this extra fat you're walking around with? I toiled with that for a long time. And I found out there was a way that I could get my weight down. Oh, I found that if I gave my patients the same advice I gave myself, it would work. So I tried it, and it works. It's simple, and here it is. I tell my patients, if you want to lose weight, don't spend a whole lot of money taking this special diet and that diet and special exercises at the gym, and don't pay this big fee for this and that. You don't have to spend a whole lot of money doing anything. As a matter of fact, you can start saving money on this program. And what is it? Eat small portions. That's it. I didn't say eat special foods. I didn't say eat this, that, or anything. Even if you're eating the right kind of, even if you're eating good foods, too much of anything is good for nothing. Even if you're eating a lot of the good stuff, you can overdo it. Eat small portions. I tell my patients, you can lose any amount of weight if you eat small portions. And I have many patients who've come back and thanked me for giving them that one little simple piece of advice. Eat small portion. If you like peas and rice, eat peas and rice. But instead of eating a plateful, eat a half a plateful. And a little while later, cut it in half and eat a quarter of a plate.
Right.
And later on, you'll be able to eat one spoonful and still maintain your taste for peas and rice and lose a whole lot of weight in the process. Eat small portions.
Keep cutting back. Keep cutting back.
That's right.
Mhm. Anyone else want to tell us how to get out of this dilemma of being overweight?
I have an entire presentation on that, right? That's titled "My Grandfather Lived to 96 and Smoked," right? It was a teaser, but you know, it came out of me just answering this young man's question once, right? And I turned to him and I said, listen, let me tell you something. And I grew up, by the way, I grew up in the countryside, you understand? I grew up in communities where people did a lot of farming. In fact, actually, I grew up in a country that, unofficially speaking, has the most centenarians per capita in the world, all right? We had trouble actually registering it because the registry burned down in 1989 and it was kind of hard to get like 3 and 4 different documents and everything, right? But the point of it is this: these 120-something-year-old lady, 115-year-old, one of my cousins reached to 116, right? The thing about these guys is this: they didn't eat processed food. They eat food from the earth. Their work was farming, actually, for the most part. In fact, one of the centenarians, he used to row 30 miles every day back and forth for like 3 or 4 days of the week to go and sell his stuff in the market. You understand where I'm coming from? So there's been a change because we're in a situation now where we exercise so much less. So basically our output is so much less, but our input is so much more.
Mm-hmm.
You understand? And honestly, that's the biggest overall issue, you know.
Mm-hmm.
Too much in, too little out.
Mm-hmm.
We drive from point A to point B, but we still eat 3 times as much food as our grandparents who spent 8 and 9 hours on the farm toiling physically nonstop.
Mm-hmm.
So it's a problem. We're in an environment now where everything is based around eating. Meetings, eating.
Mm-hmm.
Everything, eating. You understand me? And then we also have to understand the cheats. The cheats are a big thing. Why? Because that one piece of guava duff, 618 calories. But right, when we think of that, when we think of, you know, you go exercising and you have your little Fitbit there and everything, I tell you, hey, listen, you've done 4 miles, you've done 4 miles, you run for about an hour, but you burnt 197 calories. How many miles are you going to be running to burn off that one piece of guava duff? Or that one piece of cheesecake? You understand me? Those are the issues. So honestly, we can sit down and lose weight really, really quickly, you know. We just have to sit down and pluck out pluck out the cheats. We have to sit down and actually set up a lifestyle of more activity and less input. And we have to go after things that are with as little processing as possible. And if we go through these 3 principles, automatically you're going to see the weight starting to drop off. And by the way, the other thing too is sleep in bed at night. And I'm talking to myself too, right? Sleep in your bed at night. You understand me? Because that's the other issue that our grandparents had that we didn't have. Because listen, even down to my parents, you call them at 7:30 in the evening, boy, I done fast asleep. Because they go to sleep at 7 and they get up at 4. What are we doing? All right. So it is a general lifestyle change that will facilitate all of these things. And I just mentioned a few things, but I just think that those stood out.
Thank you so much. Thank you so much for your input. Sister Shandira, speak to the amount of sugar, the amount of sweets, because sugar actually has 55 names. There's a lot of hidden sugar in these processed foods. Sister Shandira speak to that sugar consumption piece? That is causing a lot of problems, especially with our children.
Yeah, so yeah, and they call it sugar epidemic as well. So but a whole lot of foods in the market, they put sugar in, and I don't think sugar should even need to be in a lot of foods. But anyway, so we really have to read our food labels, the nutrition facts as well as ingredients to see how much sugar we're actually consuming. Okay, so when you look at your so a good thing that happened is the United States Department of Agriculture, they changed their labels a few years ago, and they actually put in now how much added sugars they put in the food. So that was a real plus. And so when you look at the total sugars on your food label, you divide it by 4, and that tells you how much teaspoons of sugar is actually in your food, or in one serving of that food. Okay. And if you look at the right side, when you see percent daily value, or you see percent DV, if that's more than 20%, that food is extremely high in sugar. Okay, and so we talk about, so if you have to eat out of box or any kind of other foods, make sure it's less than 8 grams of sugar per serving. And then of course, we're gonna have small amounts of that food very infrequently. Okay, and so the sugar sweetened beverages, the sodas, the fruit drinks, and even fruit juices, we want to make sure I eat a whole fruit rather than drink the juice, because the juices do a lot of damage as well. So we really shouldn't be having them. Okay, so the American Heart Association recommends that children under 2 have no added sugars in their diet. Those 2 to about, I think, 13 years or so, that they have less than 6 teaspoons of sugar a day. Females as well, 6 teaspoons of sugar a day, and men no more than 9 teaspoons of sugar a day. So I tell people the less you, as this is added sugar to the food now, the less you have, the better off you will be. And Sister Nachi mentioned about the different names for sugar. Yes, there are so many different names for the sweetness in the food. And so you want to read your ingredients list. Anything that ends in OSE is a sugar. So if you see glucose, maltose, galactose, whatever, that's a sugar. If you see sugar, brown sugar, syrup, honey, sucrose, agave, what's the other, molasses, all of those are sweeteners. Yeah, high fructose corn syrup and corn syrup are the worst ones that you can actually consume. They cause a whole lot of health issues, and they are found in almost every food you can find. Okay, and also there's something else, can't remember, it's just slipped me. But anyway, when it comes to your, oh yes, the sugar alcohols. So you may see like xylitol or sorbitol or mannitol. All of those are sweeteners in the food. And there are artificial sweetness as well, okay? Anything that's artificial, we should not be consuming, okay? So the Splenda, the Equal, all of those, they are not fit for consumption. Even ants don't eat them, so we shouldn't be eating them either. Okay, so make sure if you want real sweetness in your food, well, use your fruits. All right, that's the food in nature that is sweet, and we can consume those. Of course, no more than like 4 servings for the day. Okay, so get most of your sweet from your fruits, naturally occurring sugars, not the refined processed ones.
Okay, thank you so much. Another question from the chat says, and let me see if I can pronounce this correctly. Can hidradenitis suppurativa be cured? Doctors, do you know, did I pronounce that right? Look in the chat.
Hidradenitis suppurativa.
Oh, it's spelled differently on the chat. Okay, Sister Dr. Miller, can you speak to that first, please?
It's a lifestyle disease, and it's usually surgically treated once it gets to a certain stage, but it can be prevented by avoiding this same type of inflammatory and high sugar and low exercise lifestyle that we've been talking about. So it's preventable, and then it's treatable if you didn't prevent it.
Okay. Thank
so
you.
lose weight to prevent it coming back over and over and over again, and follow a very healthy, whole foods, plant-based diet. And I wanted to emphasize something Shandira said about sugars. If you are taking a whole foods diet, then you don't have to worry about reading the labels for all those sugars. Because there's no label on the sweet potato. There's no label on the apple. Get your sugars as God intended. God intended us to have our sugars from the fruits and from the vegetables that are sweet, carrots, beets, sweet potatoes. So try as much as possible, and it is not difficult to spend most of your grocery money in the produce section. Let your cart be so full of vegetables, the people have to ask you questions. And that's, you'll be more healthy for it.
Yes, definitely. You know, one time I was in the food store shopping and the lady asked me, "Miss, are you a rabbit?" But that's the way I eat. Okay,
Exactly.
here's another question coming from the chat. Is marijuana smoking as dangerous as tobacco smoking?
Yes, it is. I want to say this. Smoking anything means that you're making yourself into a chimney. Human chimneys are not healthy. Smoking anything is bad for you. I don't care what it is. I see so many men in my specialty of urology who are messed up from smoking. As recently as just a couple of days ago, I've seen so many men who are infertile because of smoking grass, smoking pot. Smoking, first of all, it clogs up your lungs. Oxygen cannot get into your body as it should, and that in itself can lead to cancer and many other illnesses, heart disease, et cetera, et cetera, et cetera. But in my area of specialty, smoking does lots of damage. First of all, it plays havoc on a man's hormones. It can decrease his testosterone level. I see many men who come into me and say, "Doc, I can't raise a lick. What's wrong with me?" And I ask him, "How long have you been smoking?" Invariably, he'd say, "Well, I've been smoking for X number of years." It does lots of harm in a man's body. Women too, I imagine, but I know in the case of men, because I deal with them every day, smoking does lots of harm. Not only is it a problem of cancer, I've seen cases, just like I said a couple of days ago, where smoking has knocked a man's sperm count down to zilch. He's trying hard to get a pregnancy. Well, he will be trying hard because he won't get one without sperm, and he won't have any sperm as long as he's smoking. I've seen many men who quit smoking and the sperm count came back up. I've seen many men also who smoked for a long time. They quit smoking and the sperm count stayed down. I would advise anybody, if you're smoking, quit. If you don't smoke, don't start.
Okay, thank you so much, Dr. Evans. Menopause. Menopause, you know, there's a lot of symptoms that comes along with menopause. Can you speak to menopause for us, please? Because 1 minute you're hot, next minute you're cold, 1 minute you're happy, next minute you're sad. Speak to menopause for us, please. Dr. Alec, you're smiling. What can we do to slow down the symptoms? I don't know. Dr. Vanessa, you going?
No, I'm having issues with my battery, so my video just decided to cut out.
Okay.
And the whole thing is going to cut out next. But so menopause, again, we've been talking about the hormones. Estrogen and progesterone are the two main culprits that are gradually becoming lower as we age. And when we hit a certain point where we have not had a period for 12 months, then we say that that woman is in menopause. As Nathlin attested earlier, people who follow this type of lifestyle that we've been advocating tend to have fewer symptoms in menopause. What are the symptoms that women are talking about? Vaginal dryness, mood swings, irritability, hair falling out, and hot flashes. And hot flashes seem to be the one that people complain about the most. But those are the symptoms of menopause, and you can treat them hormonally. You can try phytoestrogens, as Dr. Elvira mentioned, the sweet potatoes, the soy products, exercise, proper nutrition. All of these things reduce the amount of problems that you will have when you go into menopause. Water intake. A healthy lifestyle works for everything. It really does.
Okay, Dr. Miller, specifically to weight gain and weight loss. Women who are going through menopause seem to gain weight quicker, and it takes forever to lose it. What can be causing that?
Well, look at your
Menopause has
lifestyle.
anything to do with controlling the weight? Does it cause you?
Does
I
what
really
have
like-
anything to do with controlling the weight? I'm sorry.
Does menopause has anything to do with it, or it's just what we're consuming? And
Your metabolism, your metabolic rate will be decreasing, but you can increase your metabolic rate by increasing your exercise. You need to make sure that you're getting adequate sleep. All of these natural remedies that we're talking about are the key. So a person who is menopausal doesn't need to be obese. Just because you're menopausal, follow the same guidelines. I'm 58 years old, and I still weigh within 5 pounds of what I weighed when I was 20.
Amazing. Okay, thank you so much. A question from the chat, and then we're going to wrap up shortly. Do physicians and nutritionists work well together, Shandira? You find that you all get along well?
Yes, for the most part, especially by Adventist physicians. Yes, we work very well together. And even in the clinics where I work, so they see the value of nutrition, and they also see, like, when they refer patients to me, they see the value, the outcome, and so they would send more patients to me. So of course there's room for improvement. We need to get it more on a national basis, but yes, for the most part, we work very well together.
Okay, wonderful.
So it's a culture that is changing. It's a
Wonderful.
culture that is changing. I mean, it's understanding that as we hit this 21st century, we realize that there's just so much emphasis on chronic non-communicable diseases, and the fact that there's so many things that are related to diet and lifestyle. The physician community is quickly realizing that we do need the input of nutritionists, and now you find them more frequently in the regular clinics. I mean, even in our specialist clinic and stuff, now we have a nutritionist, and yeah, they're, you know, the use of nutritionists is increasing, and that's a good thing. So we need to bump this up even more.
Okay, wonderful, wonderful. Dr. Mitchell, persons who tend to lose a toenail maybe like 2 to 3 times per year, what causes that, especially runners and walkers? What's causing this toenail loss?
Yeah, toenail loss. Well, a number of things could lead to that. For example, especially for runners, when they tend to run, according to the fit of the sneakers or how they tie the sneakers, the foot could be advancing forward and causing trauma to the toenail during the run. And so it may cause the nail to lift. So that's most common in like runners. But another common reason for losing toenails are, of course, fungus nail, because the fungal infection actually separates the nail plates, the actual nail from the nail bed. So persons can also lose a toenail like that as well. But the most common would be especially for runners, would be the fit of the sneakers or the movement of the foot in the sneakers. So one of the things that I advise the runners to do is to tie the sneakers a little more snugly on the top of the foot, like over the arch part, tie it a little bit snug there, or they can also use insoles that will help it wouldn't cause the front to be tight, but it'll make sure that their foot does not advance forward. But if it continues to happen, then they probably need to come in at some point so we can check it out. Thank
Okay,
you.
thank you. Thank you. Okay, Ms. Smith, what foods are rich in iron? You find that a lot of persons are coming up anemic. Which foods are rich in iron? We don't want to rely too much on supplements.
Okay, so of course, there are two sources of well, animal and plant sources. Basically, almost any animal food will give you iron, especially liver. But we don't want people going that direction. We want them to have more plant-based. Okay, so your nuts and seeds, your peas and beans will have a good amount of iron. Also, the whole grains. In particular, the leafy greens like kale and spinach, they would have some iron in it. Beets is another good source. And molasses is another good source of iron as well. But of course, that's the sweetener. So we're going to use small amounts of those. The different nuts and seeds, almonds, the walnuts, the cashews, all of them have a fair amount of iron in them that we can use. And also when it comes to the plant-based, it's a good thing to have a source of vitamin C to help absorb the iron better. So if you're having some salad, for example, make sure you have some tomatoes in there, some peppers in there to help the iron from the, let's say, some green leafy vegetables, or if you have some whole grains, to be better absorbed by the body.
Okay, thank you so much. Can you also speak to foods that can help to build the immune system? We are hearing a lot about, keeping the immune system strong, especially since COVID-19. Let's speak to that briefly for us, please.
Okay, so we go back to a plant-based diet, a whole food plant-based diet, especially foods that are high in vitamin C. That's our produce or our fruits. The guavas, the strawberries. Well, strawberries are quite local, but if you have access to strawberries, that's a good one. Of course, the citrus fruits, cantaloupe, the red sweet peppers. I mentioned guavas. They are very excellent sources of vitamin C. Also, lettuce. Lettuce is a good source of vitamin C also. And cabbage has some vitamin C in it. Pineapples, all of those are rich sources of vitamin C. And we also talked about zinc last night. So zinc is we mentioned foods that have zinc a little earlier on, but of course the peas and beans and nuts and seeds will have some zinc in them. The orange and green foods with vitamin A. So that's the orange vegetables. The green vegetables would have lots of vitamin A that helps to support our immune system. Of course, we have selenium, and you'll find a lot of these nutrients in our plant-based foods. And so even, let's say, looking at our local fruits and vegetables, our local produce, the cocoa plums, the pigeon plums, the juju, the sugar apples, all of those have a fair amount of nutrients that will help to keep us healthy, well, our immune system, and keep us overall healthy. So use what we have here. Oh yes, and coconut too. The jelly from the coconut, especially when it's hard, that is potent with nutrients. Okay, so it's good to have a little bit of those. Of course, not as long as that's a fat-based food. And also the avocado pear, when it's in season, it has some healthy fats. And of course, nuts has a lot of healthy fats, omega-3s and 6, that help to keep our immune system strong as well. But the general guideline recommendation is to eat more plant-based foods, and they will actually help to keep us healthy as well as keep our immune system healthy to prevent illnesses. Oh yes, and the herbs. All right, the turmeric, the ginger, the garlic. There's also what's the name? Black seed or the cumin is really good. It's really good anti-inflammatory as well. Cinnamon. All of those stuff that we have, those seasonings or herbs and spices in our cabinets, they are very potent in substances that cause our immune system to be really healthy and strong.
Okay, thank you so much, Shandira. Our last question, I'm going to throw it out to the all of the panelists or those who wish to speak to it. Persons tend to, once they've been diagnosed with a challenge, whether it's hypertension, diabetes, whatever, and they don't want to use the prescribed medication from the physician. And they go and, they just dabble in bush medicine. You know, I'm going to take Noonie or Neem or whatever. Can you give us a word of advice on that for our listening persons on the platform, please, about the use of bush medicine?
Before you guys address that, I would just like to say on the immune foods,
Okay.
to make sure that you're eating a rainbow. All of the highly colored foods are very good for your immune system. So the bright yellows and reds and oranges and greens and purples. If you're eating a good variety of highly colored foods. Secondly, as Shandira mentioned, the ginger, garlic, but also greens, beans, onions, mushrooms, all of the berries, and all of the seeds are excellent for your immune system. So think of eating a rainbow, number one, and number two, 3G bombs: ginger, garlic, greens, beans, onions, mushrooms, berries, and seeds.
Okay, thank you. Okay, what about the bush medicine now? Persons who are self-diagnosing and just dabbling in bush. Is there any danger in that? Is it okay to do that? Last question, and then we're going to have prayer.
I'm not an expert on bush medicine, but I will say that there are some excellent remedies out there. I remember as a child growing up, you know, Dad used to give us Soursop when you have a cold or flu. Worked like a charm, and it still works. He will tell you about a medicine called stomach bush that cured his ulcer that he had for many years and could not get treated. So yes, there is excellent value in some bush medicine. A lot of the medicines are quite freely available on the out islands or in the family islands. A lot of people talk about the Soursop leaf for cancer, and you must recognize that a lot of the cancer treatments are made from bush medicine. They go to these indigenous tribes and find out what they're using, and then they make it into, or try to find the chemical form of it, and then sell it back to you for exorbitant amounts of money. So it's important for us to find out, and I think maybe I should be an expert on this. It's important for us to find out what our people know about bush medicine and document it and teach it to our children so that they don't lose it.
Okay, thank you. Anyone else want to speak to that? Okay, if not, we will wrap up at this time. And so I will call, thank you so much, Doctors Miller, Alec, Evans, Mitchell, and Ms. Smith. Thank you so much for the invaluable information you shared with us this evening. Also, Dr. Elvira Higgs, my apologies, also Dr. Elvira Higgs. So coming now with the vote of thanks and also the closing prayer is Elder Norwood Ramming. Is Elder Ramming still on the platform?
He's on, Sister LaCroix.
Okay, thank you. Gotta open the mic.
Okay, Elder Ramming, we're not hearing you right now. We need you to unmute your mic, please.
Can you hear me?
Yes, my elder.
I'm indeed grateful to God for the privilege to be here this evening to receive such good information that will assist the entire community of South Andros and Mangrove Key. And I just want to thank Sister LaCroix and her team and our pastor, who has done a very good job. And also, I want to thank our president. And I want to thank the team of doctors that give such useful and helpful information to our people this evening. It is something that I have never experienced like this in my life, and I want each and every one of them to know that we appreciate the information that was given, and we certainly thank God for each and every one of them, and may God bless all of you as you go along throughout this life journey. Thank you one and all. God bless. Let us pray. O God, our Heavenly Father, we are indeed grateful to you for the many blessings that you have bestowed upon us. We thank you for the ministry of Sister LaCroix, and we thank you for our pastor, dear Lord, and we thank you for all of these doctors and those who have helped to bring about a change, I hope, in the life of every one of us here in the South Andros district. We pray your divine blessing upon them, and may this life journey be one that at the end of the road, we can all hear, well done, thou good and faithful servant. This is my prayer in Jesus' name. Amen. Amen.
Amen. And thank you so much, Elder Raming, for having prayed. And we want to thank the team again under the leadership of Director Lacroix for having connected with us virtually in the district of South Andros and Mangrove Key. We take this opportunity also to thank our community persons and various invited guests that would have taken the time to worship with us, to learn with us, and to be edified with us over the course of this weekend. Sister Lacroix, we want to affirm you so much. And we thank you for always being willing to partner with your home district. And for many other South Androsians that were here, Sister Smith, Dr. Miller, I don't know if I'm missing anyone else as a part of the South Andros fraternity, but we're very appreciative of you coming home virtually with us. Of course, we look forward to the time when we can greet each other and see one another face to face as we used to in 2019. That seems so long ago now. But we're pressing on, and we appreciate your continued support and prayers that you lend to the district as we all seek to serve the Master, as we look forward to his second coming, when all of this will be put to an end and we will be with him in his kingdom eternally. And so we thank everyone now that has come here, and we dismiss you all. We hope